Hi everyone, I'm Namita Jain, a wellness specialist and a wellness author. I'm at Kokilaben Dhirubhai Ambani Hospital in Mumbai, and I'm thrilled to be in conversation with Dr. Dinshaw Pardiwala, a leading orthopedic surgeon based in Mumbai. Doctor, many sports people who play football, soccer, tennis, running, jumping and do plyometric moves and twisting moves land up with ACL tear. And it can be extremely painful and also, frightening in a way. So, what is the treatment for this?
So the ACL is the anterior cruciate ligament.
Yes.
It's an important ligament in the knee that gives our knee rotational stability. And this can tear in athletes, it can tear in normal people too. But if it tears in an athlete, especially an athlete that needs twisting, turning, pivoting kind of activities, then this is going to result in all probability in what we call as instability, which means that when that athlete is running, if there's a sudden positional change, that knee is going to buckle and he's going to feel like his knee is giving way.
Right.
Now, if it's a minor tear, a partial tear, then these may be treated without surgery.
Right.
But in most instances, an ACL tear is going to require a surgical procedure. And what we do is we put a new ACL in there. So we reconstruct and put a new ACL graft there. That typically heals in about 6 to 8 months, and then during that process, rehabilitation is still going on.
Right.
Most athletes would be able to get back to their original level of sports following about 6 to 8 months of rehabilitation following an ACL surgery. So for an athlete, typically with an ACL tear, an ACL reconstruction surgery would be the treatment of choice. But just in case it's a non-athlete, someone who doesn't need to run, jump and play, then you could lead a relatively normal life even without ACL surgery. And that would require just some rehabilitation and some activity modifications where you're not running, jumping and not doing any pivoting sort of activities.
So doctor, the most important question in the mind of an athlete is, will I be able to get back to my active sport? So after the surgery, yes, you did mention it is possible. So I think that would be a relief for people to know.
The recovery rates following an ACL reconstruction are significantly high, and most competitive athletes and most elite athletes following rehab would get back to their original level of sports.
I think that is such a reassuring thing to hear. Thank you, doctor, for your time and this interaction.
Thank you.